My name is Heather Rowan, and this is my dad.
That's me.
John Rowan?
John Rowan.
I'm just going to ask you some questions about your use of Osteo-K and how you got there and how you're feeling today.
Okay.
So, why don't you tell them a little bit about when you were diagnosed? When were you diagnosed with leukemia?
I was diagnosed with acute myeloid leukemia the 5th of April of 2011. After the diagnosis, I had asked the doctor, what if I did nothing? And he assured me that if I did nothing, I would be dead in 9 days. Armed with that information, I decided to, or my daughters and the rest of my children decided that the best option would be to go to Boston and get some chemotherapy, which I did. The chemotherapy was quite extensive, and it took its toll on me physically, because I went from 223 down to 166.
In weight?
In weight.
You had a lot of complications.
A lot of problems. Taste buds disappeared.
Didn't eat. Vomiting.
Vomiting. Seizure.
You had seizures, yeah. You lost your ability to walk for a while.
I couldn't walk, fell down, broke a couple of ribs, and lost my hair, but my hair is back. And after...
So what did you do? You did one round of induction, which is 7 days of 24-hour chemo, and then you did a bunch of weeks off, and then you did another round.
Another round. After the second round,
we were hoping you'd be in remission.
And yeah,
tell them what you found out.
The test after the second round indicated that I was not in remission.
You had relapsed.
That I had relapsed and the leukemia was present. So they gave me a few options, another round of chemo, the same type that I had had, which I physically was fairly sure I couldn't handle. The other was a different type of chemo where you get chemo for 5 consecutive days, then you'd have 23 days off.
But it's short.
Yeah, it's
an hour a day instead of 24 hours a day.
Yes.
And then what were the other two options? Clinical trial?
Clinical trial, or the last one was hospice. And none of those options really, at the time, seemed palatable to me. The only one that had any inkling to me of the possibility, because I could do it locally, was the 1 hour a day for 5 days, 23 off, and then you do it again. I went through that regimen twice.
What happened during that time?
Well, physically nothing. What happened was all of my blood counts went down significantly to the point where I required a blood transfusion.
And they weren't really recovering anymore from the chemo?
No, the chemo, I mean, the only thing that was obvious to me was the blood counts after the chemo would go down significantly to the point where I would require a transfusion within a week or 2 weeks or 3 weeks.
Platelets and blood, both, right?
Platelets and blood, yes.
So, let's take people back to when you started taking Osteo-K. You were home for what, about a week?
Yeah, I started taking Osteo-K based on my daughter's research, and I had indicated to her, or I told her, that, if she found something, I would try it. And I've taken it ever since.
So you started it, about July 31st of 2011?
Yeah.
And when you came home the week before that from the hospital, how much time did they give you to live?
3 months, could be a couple of weeks to 3 months. And it was just a very scary time. The frightening part of the whole situation is that they haven't got a clue as to what causes this or what they can do to effectively isolate it, contain it, stabilize it. They had no answers. Because everyone I had asked, and I'd asked a number of these doctors who were oncologists, where does it come from? They haven't got a clue. Don't know.
Well, that's where, when I searched vitamin K2M4 and vitamin D3, I found that in Japan, they had done a number of clinical trials using those two vitamins together, and that they were not only killing acute myeloid leukemia cells, but they were also causing those cells to turn into healthy cells. And so that's part of the reason why we started that. And when we looked for the K2M4 in the United States, we found that Osteo-K had both the K2M4 we needed and the D3 mixed together. So we started you on, what, 45 milligrams for 2 months? Yeah. And then we put you up to 90 milligrams. And ever since 90, tell them what your blood counts have done.
My blood counts have stabilized. The doctor doesn't understand it. And he's been informed that this is what I'm taking. They say, well, you know, they don't know, and the only thing that I can say is that I haven't had chemo or any type of chemo in 5 months. I haven't had a blood transfusion since the day after Thanksgiving of 2011.
And what's today?
Today is the 27th of March, 2012. So I'm going for, I've been getting my blood tested weekly for the past couple of weeks because I had cut on my hand and my white count was elevated. So to be sure that there was nothing else going on, I had it done the following week and again last week. The result being the counts came back down, and the elevation of the white was because of this cut I had on my hand. So tomorrow I go for my blood work again, and the way I feel right now is that it should hopefully be stable, to the point stable in as much as it's not going down, and I'm not going to require a blood transfusion.
Well, tell them what your white count is normally. What's it hanging around? 10? 10.5?
It's hanging around 10, 9.7.
Your platelets?
Platelets have gone up to 190.
And your red blood cells are, you know, you're anemic, but you're stable and...
Yeah, the counts they're not fluctuating. There is slight movement one way or the other, but it's ever so slight. There's no drastic, like the 1 week, my white count was 16 point something.
Do you remember what your counts were when you were diagnosed?
No.
Your white count was 1.7, and your red was 2.1, and your platelets were 70.
Well, platelets are now close to 200, and the other counts of the red is not going up, nor is it going down. It is stabilized to the degree that it is, but there's no obvious indicators in the blood work that something is starting to come back, or it's...
No, there's no evidence of any kind of blasts in your blood or anything.
At this point, no.
And I mean, what is your day like? I mean, are you laying in your bed all day feeling sick?
No, my day, I get up, go to the store, get my wife coffee in the morning, make breakfast, go to stores, do normal stuff. Not as much as I would like to do, however, before I got sick.
Well, what did you do this weekend? Like, what did you do Friday night?
No, I went to a concert that my grandson had at his school, and then last night we had a birthday party for my grandson, and you know, it's business as usual. I mean, I'm not laying around or taking naps. If I feel tired, I take a nap, but I haven't taken a nap in weeks. So the Osteo-K and the D3 are doing something, because the doctor has no explanation for it, and
It's ever since you started it.
ever since I've started it, things are different. They're certainly better for me, and the blood work tests that they're doing indicate that there's nothing obvious or to be, further looked into or whatever, which is fine by me.
And if you listen to the doctors when you were home from Boston?
If I listened to the doctors, I wouldn't be here making this recording. Because it's quite scary that they haven't got a clue, and they'll readily admit they don't know, they don't understand, and I'm very thankful for Osteo-K and my daughter's perseverance in looking into this, as well as my other kids who put me through the rehabilitation of walking and rowing boats or rowboats or whatever, and the treadmills to get me back in the shape I'm in. I'm now stabilized pretty much between 179 and 181, and it's staying there.
And your blood counts are stable?
My blood counts are stable.
Energy's good?
Energy's as good as gets. I mean, I would certainly like to be better. However, what I have is fantastic compared to what I came home from Boston with.
And do you feel like your life's pretty normal now?
It's as close to normal as I think I can get. I would like to be better, so if taking more Osteo-K would do it, I'd certainly do it. Or if an improved version of this product came up, I would certainly go for it.
I feel like if you weren't on Osteo-K combined with the other supplements that we have you on, that you would be dead right now.
There's absolutely no doubt about it. I mean, it's the doctors indicated that, just call hospice, and that's one phone call I'd rather not make. So, if there's anyone out there who has AML, feel free to give me a call, because I'd certainly discuss it with you. I mean, it's the chemo part of that is tough stuff.
It's been a tough road, but I believe if we didn't have Osteo-K, I wouldn't have my dad anymore. And it's been 8 good months. He's felt good, looked good, been my dad again. And if we didn't have these vitamins to give to him, I know he wouldn't be here. And I just hope that other people that are sent home, maybe that are told to call hospice and they think that there's nothing else that can be done, know that there are other options out there like Osteo-K that, if we didn't try it, like I said, I'd hate to think where we'd be. So thank you guys for developing this awesome formula. Thanks for giving me my dad, and we can just keep everybody updated. Thank you.
Thanks a lot.